Welcome, everyone. Good afternoon. Thank you for joining us today to actually share a little bit about today's webinar, the Environmental Justice Index, a national tool to measure the cumulative impacts of environmental burden on health. Today, we are recording this webinar so we can post it online for later viewing. Therefore, we will not be taking live question and answers, but please continue to submit any questions that you may have to the following site, EJI_coordinator@cdc.gov. We're also pleased today to be offering a version of this webinar with Spanish transcription available at HHS.gov/live. Feel free to go there now if you prefer. By way of introduction, my name is Sharunda Buchanan, and I come to you today wearing a dual hat. I serve as Director of the Office of Priority Projects, Innovation and Environmental Justice at CDC's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry, as well as Interim Director of the Department of Health and Human Services, Office of Environmental Justice. I'm an African-American female, and I go by the pronouns she, her, hers. And today, I'm wearing a blue blazer and a light blue shirt. And behind me is a blue background with CDC ATSDR and the HHS logo on it. My co-presenter today, Geospatialist Benjamin McKenzie, will also provide you with an introduction of himself as we delve into the presentation and demonstration of the Environmental Justice Index. So with that, I believe we'll get started. First slide, please. I'd like to bring your attention to a couple of presentation objectives. The first thing we want to do is bring attention to the intersection of health equity and environmental justice. Secondly, we want to highlight the social and physical environmental factors that serve as underlying determinants of health. And then thirdly, of course, we want to demonstrate the utility of the Environmental Justice Index as it addresses determinants of health in pursuit of environmental justice and health equity. Next slide, please. We'll start with a little bit of terminology. First, health equity. And what does that mean? Striving for the highest possible standard of health for all people and giving special attention to the needs of those at greatest risk of poor health based on social conditions. Health disparities. Differences in health outcomes and their determinants among segments of the population as defined by social, demographic, environmental, or geographic category. Social determinants of health. Conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life, risk, and outcomes. And then the last term, last but not least, environmental justice. Advancing health equity and eliminating environmental health disparities through the fair treatment and meaningful involvement of all people in environmental health policies, research, and programs, and ensuring equal access to a healthy environment. Rationale for environmental justice, and exactly what is that rationale? People of color, disadvantaged, vulnerable, low-income, marginalized, and indigenous people are disproportionately burdened by environmental hazards. These populations and communities are exposed to environmental threats that drive health disparities. They're underserved, and they're surrounded by social inequities. The combination of environmental risk and social inequities create a cumulative, disproportionate impact that hinders optimal health and environmental justice for these populations. Next slide, please. I always like to say that environmental justice and health equity are inextricably linked. If you find an environmental injustice, you're likely to find a health disparity. As you can see, that links those two terms, environmental justice and health equity. This particular slide is showcasing that over 42 million American homes suffer from energy poverty, making them vulnerable to intense heat and cold. More than 2 million Americans live in places or communities where they don't have basic access to drinking water, safe drinking water, and sanitation. They live without this. And then 11.9 million Americans, disproportionately people of color, are exposed to unhealthy air pollution levels. These are just examples of how environmental justice and health equity are inextricably linked. Next slide, please. I want to bring your attention to Executive Order 12898. Executive Order 12898, Federal Actions to Address Environmental Justice in Minority Populations and Low-Income Populations, directs federal agencies to making achievement environmental justice part of its mission by identifying and addressing as appropriate disproportionately high and adverse human health or environmental effects on its programs, policies, and activities on minority, low-income, and indigenous populations. As we can see, this executive order was released more than 25 years ago. And the challenge is that even some 25 years later, some intransient environmental health disparities and injustices persist. These are things that we want to focus in on today. Next slide, please. I want to bring your attention also to some additional executive orders, bringing us back to now 2021 and 2022. In last year, 2021, these three executive orders were released. These are equity and justice related presidential executive orders that actually reflect on what we're talking about today. Executive Order 14008, Tackling the Climate Crisis at Home and Abroad. Executive Order 13985, Advancing Racial Equity and Support for Underserved Communities through the federal government. And then last but not least, Executive Order 14035, Executive Order on Diversity, Equity, Inclusion, and Accessibility in the Workforce. I'd like to read just a quote from Executive 13985. Because advancing equity requires a systematic approach to embedding fairness in its decision-making processes, executive departments and agencies must recognize and work to redress inequities in their policies and programs that serve as barriers to equal opportunity. A very, very key executive order. But also as you focus in on Executive Order 14008, Tackling the Climate Crisis at Home and Abroad, it really gets and speaks to the issue of environmental justice. Next slide, please. It's the very Executive Order 14008 that actually created the Office of Environmental Justice at the Department of Health and Human Services. The Office of Environmental Justice at HHS was established within the Office of Climate Change and Health Equity on May 31st, 2022. The Office of Environmental Justice will serve as a departmental-wide hub for leading initiatives that integrate environmental justice into HHS's mission to improve health in environmental justice communities and for vulnerable populations across the nation. The very mission of this office is to protect the health of disadvantaged communities and vulnerable populations on the front lines of pollution and other environmental hazards that affect health. Our ultimate goal here at the Office of Environmental Justice is to be a resource for underserved and overlooked communities. Next slide, please. As we focus in on social determinants of health, Healthy People 2030 uses a place-based framework that outlines 5 key areas of social determinants of health. 1, healthcare access and quality, neighborhood and the built environment, social and community context, economic stability, and then education, access, and quality. These are the 5 pillars of this place-based framework that outlines social determinants of health. Next slide, please. I'd like to bring your attention to the intersection of social determinants of health, environmental health disparities, and health equity. As we peer a little deeper to think about what those impacts are and how it does affect health, we see that those impacts include energy, housing and food insecurity, heat islands, unsafe housing, extreme weather events, climate migration, pollution exposure, and of course, all of this is leading to worsened mental health. These are very, very key impacts. And as we look back on the origins of a good bit of this, we're looking at things like systemic racism, redlining, and disinvestment. These are all very, very key issues that outline and make up and included in the intersection of social determinants of health, environmental health disparities, and health equity. Next slide, please. Let's really talk about this in another framework as we look at the social, cultural, and neighborhood and built environment pieces of this. If you look across the very top of this particular graphic, and we're looking at things like racial residential segregation, urban sprawl, inaccessible resources, dilapidated housing and community design, and all of what it leads to are particularly connected to on the bottom of this particular graphic. Starting on the right-hand part of this graphic, looking and peering into community design. And this, the way you build your environment and when you shape your environment, all leads to something. It can have an effect on health. As we're looking at those outcomes, obesity, lack of public parks and recreational places, toxic waste and public spaces that are really fraught with environmental injustices. Let's focus in on the next part of the slide here, the graphic. Dilapidated housing. Of course, that can, of course, lead to things like lead poisoning and asthma, injury, all, of course, leading to, in some shape, form, or fashion, poor nutrition. In the middle of the graphic, focusing in on accessible resources and the fact that that's interrelated and interconnected to jobs and transportation, the ability to get fresh food and access to healthcare. Urban sprawl, leading to things like noise and mental health, overcrowding, indoor and outdoor air pollution. And then last but not least, on the far left of this particular graphic, and all of what leads to in terms of education and poverty and spatial mismatch. Again, all of this interconnectedness and all of this taken together as we're focused on the social determinants of health, we know that it's the cumulative nature of all of these issues that we really want to focus on because of the inextricable connectedness of health equity and environmental justice. With that, I am going to turn this over to my colleague, Benjamin McKenzie, and he's going to present on the Environmental Justice Index. Take it away, Ben.
Thank you so much, Dr. Buchanan, and good afternoon, everyone. As Dr. Buchanan said, my name is Ben McKenzie, and I am a geospatial epidemiologist with the Geospatial Research, Analysis, and Services Program, which we call GRASP, at the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry, or ATSDR. I identify as a white man, and my pronouns are he, him, his. For descriptive purposes, I'm wearing a blue dress shirt and a black jacket and have a blue CDC ATSDR background behind me. So today, as Dr. Buchanan mentioned, I'm going to give you an overview of our Environmental Justice Index, or EJI, including some background on environmental justice mapping and screening tools generally, as well as information on how our index, the EJI, is calculated. I'm then going to take some time to show you all some of the resources that CDC ATSDR makes available to learn more about the EJI and how to use our interactive data tool, the EJI Explorer, to really interact with EJI data and embed it into your work. So I'll begin with just a short description of exactly what the EJI is. The EJI is the first national place-based tool that's designed to measure the cumulative impacts of an environmental burden on health through the lenses of environmental justice and health equity. And that phrase, cumulative impacts, is a key one, and one that I'll discuss a little bit more in depth later in this presentation. But in short, that term refers to the multiple environmental, social, and other stressors that are present at the community level that really build on each other and interact, as Dr. Buchanan said, to produce patterns of health and well-being. And this concept of cumulative impacts is really intertwined with those social determinants of health that Dr. Buchanan introduced just a moment ago. The EJI assigns a single score to each census tract in the United States that represents the relative cumulative impacts of environmental burden on health. As this slide says, the EJI was developed as a collaboration between CDC and ATSDR in partnership with the Department of Health and Human Services, Office of Environmental Justice. This tool builds on existing environmental justice and cumulative impact screening tools and methods, taking a framework that was originally developed at the state level and applying it nationally in response to calls from environmental justice communities, scholars, and others working in this realm of environmental justice and health equity. Which really brings us to the guiding purpose of the EJI, which is to advance those CDC and HHS goals of environmental justice and health equity, those inextricably linked goals that Dr. Buchanan introduced a minute ago. We see the EJI as contributing to these goals, contributing to environmental justice and to health equity by empowering communities, public health officials, and others to identify areas experiencing the most severe cumulative impacts of environmental burden and injustice on health and well-being, and to help to focus efforts aimed at addressing these systematic injustices and the social determinants of health in these communities. As I said a moment ago, the EJI builds on existing environmental justice mapping and screening tools, tools that have really been developed and refined over the last decade. I want to take just a moment to talk a little bit about what some of these tools are and how they link to the broader environmental justice movement. These tools, again, largely developed at the state level, although there have been more federal tools coming out recently, provide policymakers, researchers, and communities with spatial data on environmental burden and other factors associated with environmental injustice, often with the aim of identifying those most vulnerable, most overburdened communities. These tools, some developed again by state agencies, some by academic groups or community organizations, are used to put issues of environmental injustice into context, sometimes helping to prioritize actions like environmental remediation or public health interventions. More recently, again, we've seen also a rollout of a number of tools with broader social, environmental, and economic focuses, tools that have been developed by federal agencies as part of efforts to comply with the White House's Justice 40 initiative, which seeks to direct at least 40% of benefits from certain federal investments to so-called disadvantaged communities. These include the White House's Climate and Economic Justice Screening Tool, otherwise known as CJEST, as well as tools from the Department of Energy and the Department of Transportation. Environmental justice mapping and screening tools, again, a growing concept out there, but they're not a silver bullet addressing the many complex and interrelated problems facing communities experiencing injustice. However, they are useful tools in the arsenal of environmental justice advocates and scholars, as well as public health officials, policymakers, and again, really anyone working in this space to improve environmental justice and health equity. But again, as you can imagine, with so many tools out there, there's a lot of variation in what these tools measure and how they're intended to be applied. So just to illustrate this, I'm going to give two examples of existing environmental justice screening tools that use different methods and have different applications. First, we have the US EPA's EJ Screen, which is a very well-known environmental justice mapping tool and one that's been around for a while. EJ Screen, which is currently on a 2.1 release, provides 12 different environmental indices as of their most recent update. And these indices are designed to highlight areas of excess risk and are presented alongside other helpful visualizations that help EPA to prioritize and to report on agency environmental justice actions. EPA also encourages others to use EJ Screen for things like educational programs, grant writing, and community awareness efforts. And because it provides quality, national level, and granular data, EJ Screen is widely used for these purposes and for others. However, EPA does not use EJ Screen to assess those cumulative impacts of multiple environmental and social factors on health, and nor is that a use that they encourage. California's CalEnviro Screen tool is a great example of a state-level tool that does address these cumulative impacts. Actually, the first of its kind to be officially adopted by a state back in 2013, but certainly not the last, as I'll touch on in just a moment. At a very high level, CalEnviro Screen brings together 21 different indicators representing aspects of pollution burden and population characteristics. These indicators, taken together, highlight areas that are socioeconomically disadvantaged due to factors like poverty, linguistic isolation, and unemployment, and are burdened with poor environmental quality from multiple sources of environmental pollution. CalEnviro Screen scores have been used by various state agencies to prioritize California's environmental protections as well as compliance efforts, particularly in communities facing the greatest burdens and with the fewest resources to change environmental conditions. This method, CalEnviro Screen's method of combining these data on multiple pollution sources and population characteristics to get at those cumulative impacts on health, has been really popular among many environmental justice advocates and scholars who recognize the importance of understanding the intersection of all of these factors. So much so that in the past couple of years, states like Washington, Michigan, Colorado, New Jersey, and others, kind of an ever-growing list of states, have all recently passed legislation designed to address environmental injustice and its impacts on health, using cumulative impacts tools and this cumulative impacts framework. The US EPA has also recently committed to developing a cumulative impacts framework for that agency's environmental justice activities by fiscal year 2023. Overall, this issue of cumulative impacts has become more and more recognized as an important kind of hot button issue in the field of environmental health, as more and more people acknowledge the importance of measuring cumulative impacts as a way to promote environmental justice and health equity, which is why, again, we developed the EJI as the first national tool designed to do this. So after all of this talk about cumulative impacts and their importance, I want to just spend a minute explaining a bit more about what exactly cumulative impacts are, as well as why it's so important that we measure them, particularly in terms of advancing environmental justice and health equity. Cumulative impacts are a measure of the total harm to human health of multiple environmental burdens, chronic health conditions, and social stressors, all acting together on health over time. All of these factors build on each other to produce patterns of health and well-being. Just to give an example, if you have one neighborhood with high levels of air pollution, but everyone in that neighborhood is in good health, they can afford air filters and medical care, and say that you have another neighborhood with similar levels of air pollution, but that neighborhood is also facing water pollution, a poor built environment, and residents with poor health who just can't afford the same quality of healthcare. It's pretty clear which neighborhood is going to be worse off in the long run. And so it's critical for us to measure all of these factors, environmental, social, and health factors, together in a way that acknowledges and accounts for their interrelatedness and how these factors act together to drive patterns of health, well-being, and health inequities. This is what we've done with the EJI, where we measure these cumulative environmental burdens, social vulnerabilities, and health vulnerabilities. And while it's important to measure cumulative impacts for the reasons I just covered, I always like to emphasize some limitations to the EJI, as well as to cumulative impacts mapping tools more broadly. These cumulative impacts mapping and screening tools, again, tools like the EJI, as well as CalEnviroScreen and other tools being developed at the state level, use a variety of detailed quantitative, as well as less detailed semi-quantitative data to kind of provide context and comparison for the combinations of multiple chemical and non-chemical stressors facing communities. For this reason, they're not designed to tell an individual or community whether their health is at risk from a particular environmental exposure, but again, rather to provide that high-level context and comparison. So I always like to show this figure by some of the leading scholars on cumulative impacts mapping and screening, because I think it does a really great job of highlighting how tools like cumulative impacts mapping compare to other tools like health risk assessments that really can provide detailed measurements of health risks from exposures. However, as this figure shows, these tools like health risk assessments require a lot of detailed quantitative data on things like precise chemical concentrations, community behaviors, routes of exposure, and so on, data that simply isn't available at anything approaching a state or national level. This is why a cumulative impacts mapping approach brings in semi-quantitative data, data like modeled data on social, environmental, or health factors, or measures of proximity to polluting land uses, kind of proxies that help to produce a tool that is valuable for high-level context and comparison, even if it can't be taken specifically as a measure of community level or individual level risk. So again, now that I've covered why it's important to measure cumulative impacts, and I hope I've convinced a few people of that, I'll go into how we measure cumulative impacts within the EJI. The EJI uses data from the US Census Bureau, the EPA, the US Mine Safety and Health Administration, and the CDC to rank relative cumulative impacts in communities across the United States. The unit of analysis for the calculation and display of the EJI are census tracts, which are subdivisions of counties commonly shown or are used to show neighborhoods. There are about 72,000 populated census tracts in the United States, and EJI scores are available for most of these, with the notable exceptions of Alaska, Hawaii, and US territories, where we really just don't have sufficient environmental data at the national level to provide these kind of national level comparisons. Which is something that we are working towards providing so that we can measure these areas within our index. The EJI consists of 3 modules that represent those 3 building blocks of cumulative impacts that I kind of laid out a moment ago: environmental burden, social vulnerability, and health vulnerability, all of which I'll kind of go into a little bit more detail about in a moment, and all of which interact with and build on each other to produce those patterns of health outcomes and health disparities. These three modules include a total of 36 indicators, each again calculated using nationally representative data sets from the agencies I mentioned before, and each measuring a distinct environmental, social, or chronic health condition that contributes to the overall cumulative impacts on health. The EJI measures these using a percentile ranking method, which essentially means that census tract scores represent comparisons to all other census tracts within the index along a 0 to 1 scale. Therefore, an EJI score of 0.85 for a given community or for a given census tract would indicate that that tract in question experiences more severe cumulative impacts from environmental burden, social vulnerability, and health vulnerability than 85% of all other census tracts in the nation. So again, you can see that what this tool is really designed to do is to offer those comparisons and high-level context for issues of environmental justice and health equity at the community level. These methods are peer-reviewed and tested. Again, they've been widely used by other tools. They're also relatively simple, easy to communicate to a range of users with varying backgrounds. And finally, these methods are easy to adapt to local needs and circumstances. We know that environmental injustice occurs locally, and so creating this kind of simple and effective system for measuring cumulative impacts that's easily adaptable to the local level is key. At this point, I'd like to quickly give you all a deeper look into these three EJI modules, and then zoom back out to give an overview of those resources that CDC ATSDR provides to learn more about the EJI, as well as to interact with the EJI data itself. So we'll start with the first module, the environmental burden module of the EJI. The environmental burden module includes 17 different indicators, each representing a feature of the environment whose presence or absence contributes to overall environmental burden on health. These indicators are separated into 5 functional groups that we call domains, each of which represent aspects of air pollution, proximity to potentially hazardous and toxic sites, both positive and negative features of the built environment, proximity to noisy and polluting transportation infrastructure, and finally, water pollution. All of these factors contribute in some way to community health and well-being, and many of them really build on each other, amplifying overall effects on health. It's important to note here that this environmental burden module does not, nor is it intended to, capture all environmental issues that a community may face. Data for some important environmental justice issues, issues like indoor air pollution or septic system failure and associated soil contamination, are not available as national data sets. Other data representing drinking water quality or agricultural pesticide use are available nationally, but not in a form that we can use for this kind of spatial tool. We really hope to build on this tool as more environmental data become available. But I always like to highlight that when considering cumulative impacts, especially on cumulative impacts and environmental burdens, it's always helpful to view local data on environmental justice issues alongside the EJI and to incorporate community consultation to really identify all of those individual environmental issues facing communities. The second module of the EJI, the social vulnerability module, includes 14 indicators, sorted into 4 domains representing aspects of racial and ethnic minority status, socioeconomic status, household characteristics, and housing type. A structure very similar to that of the CDC ATSDR Social Vulnerability Index, for those familiar with that tool. These are all factors that are known to modify or to compound the effects of environmental burden on health. These are also factors that represent aspects of procedural justice, the ability of communities to influence environmental decision-making. Our third and final module is our health vulnerability module, which includes 5 indicators representing prevalence of key chronic conditions that are associated with environmental justice and health equity. Conditions like asthma, cancer, high blood pressure, diabetes, and poor mental health. People with these pre-existing conditions are more susceptible to the effects of environmental burden on their health. Environmental factors like air pollution, noise pollution, and aspects of the built environment have been shown to exacerbate disease in people with these health conditions. So again, as you can imagine, this health vulnerability just compounds those issues of environmental burden and social vulnerability to drive those overall cumulative impacts on health. So now that I've introduced what the EJI is, provided some background on the tool, and given you some insight into how the tool was created, this is the part of the presentation where I get to go over some of the resources that CDC ATSDR makes available to learn more about the EJI, including our website and our interactive map. And I know that we have over 1,000 people registered for this webinar and more joining through the HHS live stream. So if you're trying to follow along with everything I'm showing you, some sites may be a little bit slow to load. The landing page for the EJI can be found at eji.cdc.gov, where you can find information on environmental justice and the EJI, as well as a number of helpful informational materials, including a fact sheet, FAQs, and detailed technical documentation for those who really want to get into the weeds on theory, methods, and really the scientific basis for the EJI. All of these are available as downloadable PDFs as well. You can also navigate from the EJI landing page to the EJI Explorer, which offers a way to visually interact with EJI data. And we'll go ahead and navigate there now. Here at the top of the EJI Explorer, we have our vision for the EJI, measuring cumulative impacts to build towards a cleaner, healthier, and more equitable future for all. We also have links for accessible data options for the vision impaired or others using screen readers, an email address to submit feedback on the EJI, as well as options for data download. However, the map is the real star of the show here, providing that high-level overview of which communities are facing the most severe cumulative impacts as calculated by our index. Focusing in on the map itself, over here on the left, you'll see a quick start guide that walks first-time users through ways that they can search and filter to concentrate in on areas experiencing the most severe cumulative impacts on health. We know that many users will be primarily interested in conditions in their home county or in a specific county of interest. So the first feature shown here in the Quick Start Guide is the state and county selector. I'll go ahead and show, I've used this to focus in on DeKalb County, Georgia, which is my home county. And I can already start to see some patterns here. A mix of EJI scores throughout the county, with higher scores representing more severe cumulative impacts in the south and east of the county, and lower scores, again, representing less severe cumulative impacts in the north and west of the county. Now, if I really want to dig down and get more information on cumulative impacts and the factors contributing to those impacts near where I live, work, or otherwise spend time, I can see in the Quick Start Guide that there's a search feature that will take me to a specific address or set of coordinates. So again, kind of showing off the result of this, I've entered in coordinates for the CDC Chambly campus here in DeKalb County. And once you've identified a census tract of interest, identified a site of interest, either through the map or through entering in an address, I can click on an individual census tract to view information like total population and overall EJI score, again representing that relative percentile rank, as well as percentile ranks for each indicator and domain included in the EJI. So you can see here that this tract experiences particularly severe cumulative impacts from factors such as ozone, PM2.5, diesel particulate matter, and air toxic cancer risk. And again, factors with particularly high scores have this red mark next to them, indicating that that factor for that census tract is in the top 75th percentile in the nation. For those kind of following along at home, you can't see it here, but for you following along at home, you can also see that this census tract is flagged as experiencing high prevalence of diabetes and poor mental health compared to the rest of the United States, as well as for factors in kind of the minority status and socioeconomic status domains. And again, you can view all of this information for each tract for which EJI data are available, comparing and contrasting what factors, environmental, social, or health-related, may be driving higher or lower cumulative impacts in your communities of interest. Users can also click on the names of individual indicators within the pop-up, which will direct them to an indicators page on our website. Here you can find out more about what exactly each indicator represents, where this data comes from, and how these indicators may contribute to overall cumulative impacts of environmental burden on communities' health and well-being. You can find all of this information here at the EJI indicators page. I also want to mention another feature on the EJI Explorer, our EJI highlights. These are real-world examples of areas with well-known short examples aren't intended to go into a great deal of depth, but rather to point users to the established literature where they can learn more about environmental justice issues facing these communities. However, EJI highlights also provide a data context for the cumulative impacts facing communities in these areas. You can see, for example, that census tracts in Flint, Michigan experience more severe cumulative impacts than 85% of all other census tracts in the nation on average. Users can also click on these highlights to zoom into these areas and explore the data more deeply at the community level. We've developed EJI highlights for Flint, Michigan, Warren County, North Carolina, and the San Joaquin Valley of California. And we're looking into developing more of these highlights, again, for areas with high profile environmental justice concerns, bringing these issues into focus through the application of our data. I also want to stress again that the EJI and other environmental justice mapping and screening tools are not a silver bullet for addressing environmental injustice and health inequities. These data are intended to start conversations and not to end them. That's why we take the approach of introducing the data first through these overall cumulative impact scores, providing an entryway for users to focus in on issues and then to explore these data further. We also always encourage users to look into additional data on environmental justice issues, data that may be available for their area. And then finally, to gain community perspective on environmental justice issues that they may be facing, as the data that we have available may not be highlighting all of the issues that individual community members feel are the most important to address. I also want to make sure to mention that EJI data is accessible through our partners at the National Environmental Public Health Tracking Program, who have integrated the EJI into their environmental justice dashboard alongside other environmental justice data and visualizations. The EJI is also available on the Tracking Network's Data Explorer application, which allows users to visualize EJI scores side by side, along with a wealth of other environmental public health data available through the tracking program. I also want to mention the importance of community engagement in our efforts. Participatory justice through community engagement is a principal tenet of environmental justice. Environmental justice requires that communities are given a place at the table in anything related to environmental decision-making, and that's what we intend to do with this tool. CDC and ATSDR, in partnership with HHS, are committed to engaging with communities, EJ advocates, public health partners, and subject matter experts to refine and improve the EJI for future iterations. We're working with people at CDC and HHS to produce live demos and webinars such as this one, as well as other opportunities for users and community members to learn more about the EJI and to provide structured feedback that we can use to improve and refine our tool. Finally, I want to reiterate that our guiding purpose in developing this EJI has been to advance CDC and HHS goals of environmental justice and health equity. We see the EJI contributing to these goals by empowering communities, public health officials, and others to identify U.S. communities experiencing the most severe cumulative impacts of injustice on health. By doing this, the EJI can help to focus actions on areas with the greatest need. It can help to shape public health interventions, interventions aimed at alleviating health inequities. It can help to guide hypothesis development by people researching issues of environmental justice and health equity. And finally, it allows policymakers and public health practitioners to establish meaningful goals for advancing health equity and to track progress and evaluate success in this regard. I'd like to close out by thanking the EJI team and our collaborators. We've had a great group contribute in one way or the other. Special thanks to our partners at the NCEH National Environmental Public Health Tracking Program, the NCEH Office of Priority Projects, Innovation and Environmental Justice, and the HHS Office of Environmental Justice. I also want to make sure to thank subject matter experts from the Division of Population Health and the National Center for Chronic Disease Prevention and Health Promotion, as well as the Lead Exposure Risk Index team from the National Center for Environmental Health and ATSDR for their subject matter expertise and contributions. I also want to make sure to thank NCH ATSDR leadership for their steadfast support of this project. And finally, all of the individual contributors, epidemiologists, technologists, health communication experts, and others who have brought their energy, expertise, and passion to this project. And then finally, I'd just like to thank all of you for your attention. And I will turn things over to Dr. Buchanan to close out. Or before I turn things over to Dr. Buchanan to close out, I just want to mention again that you can find the EJI landing page at eji.cdc.gov, and you can contact us with any questions at EJI_coordinator@cdc.gov. Thank you, and thank you, Dr. Buchanan.
Thank you, Ben, so much. I'd like to lend my voice to the thank you for all of the contributors and subject matter experts that actually contribute to development of the Environmental Justice Index. Also want to thank you, Ben, my wonderful co-presenter, for that really inspiring and wonderful and outstanding presentation on the Environmental Justice Index. And as you've done, Ben, I too would like to thank all of you, the audience who has joined us today for this presentation on the Environmental Justice Index. I want to again draw your attention to the slide that you see facing you on the screen. If there are other questions or there's more feedback warranted, particularly go to the EJI _coordinator@cdc.gov. Thank you all so much for your time and attention today. And we are here if any questions should arise. Thank you so much. Go everyone and have a great rest of the day. Thanks.
Produced by the U.S. Department of Health and Human Services.